Hello, I'm Lori Mariucci. It is my pleasure to host this video to serve as our annual report to the community. We remain committed to services and supports to focus on our mission, to help those we serve to reach their full potential. As the Medicaid administrative agent, we determine eligibility for services and monitor service delivery. And we also have several initiatives we believe will help make our community more inclusive. The board offers services to individuals that span a lifetime, starting with the very, very young and early intervention.
There's not enough words in the dictionary, I think, to explain the impact that early interventions had with our family. We were put in a position with a very rare and unique disorder that we had no idea what to do. We had no idea where to turn. And to be honest, early intervention was the first constant that we received that really helped guide us through everything that we have been through with our children.
We are strengthening our partnerships with local school districts, child care centers, and community organizations. And sometimes inclusion doesn't come easily, but everyone works to make it happen.
Very receptive to the thought, and then when they get down to it, there's a bit of fear. They're not sure what they're getting into, or they hear a story and think they have to know and understand everything just to work with someone. So we come in and just try to say, we're all humans, just be kind. And for kids, the fun part we get to say is, let's just play and let's have fun together.
Another major initiative from our children's department is helping older teenagers prepare for the upcoming adult world.
Let's really help your child figure out what are his or her strengths, what are her areas of interest or his. Where can we look in the community to try out some of these skills and see where their interests lie and where they might be successful in future employment, volunteering, or however they choose to spend their days.
Individuals will be better served as we employ the principles of trauma-informed care.
What we've been working on is people understanding that trauma is something that most people have in their life and the impact it has on them. So if somebody has been bullied, for example, that has an impact on their entire life. And some people it might have more impact on than others, but how do we respond and recognize that so we make the board a safe place to be?
And we are working at increasing resources for individuals with dual diagnosis.
We have worked with the Mental Health Recovery Services Board as well as several mental health agencies and hospital psychiatric units, and both colleges and universities in the area in order to develop a relationship, share information, both training to provide it and to receive it, and really get to know people so that we're working together to provide the highest possible quality services for those individuals with a dual diagnosis.
Through the use of success coaches, we are helping the provider community recruit and maintain direct care staff.
So we provide coaching and referral services for barriers that employees face, things like childcare, transportation, having a safe place to live, finding financial resources when they're short at the end of the month. All of those services affect their ability to get to work and serve the people that we serve. And so the success coach is working with people to remove those barriers so that they can get to work.
We have 11 providers who are presently in our employee resource network. The board is fully committed to the concept of technology first, utilizing remote monitoring techniques.
And the individual not only has a tablet, but there usually is sensors around the house or a camera at the front door to see who is coming and going. And the staff can do 15-minute checks. They can do minders, meaning remind the individual, don't forget to take a shower, pack your lunch for work, take your medicine, and they check in with the individual, and the individual can check in with them via the tablet.
And individuals who are utilizing the remote monitoring are finding an improvement in the quality of life.
Individuals that we worked with that have remote support absolutely love it because they feel like they can live in their space, be independent, and not have a staff person glued to their hip 24 hours a day. They have the capability to reach out to staff if they need something, but at the same time they can sit on their couch, eat their bag of chips and salsa, and watch TV without being bothered by a staff person glued to their side.
Individuals with developmental disabilities are among the most vulnerable. That's why we have taken an active role with the Human Trafficking Coalition.
3 things that your traffickers do look for when it comes to our actual individuals. They know that they have an SSI check, they normally have their own place where they stay, and that they actually can be used close to about 45 times a day for the sex trades. So that's part of the reason why we're heavily involved with human trafficking at this point.
The idea of human trafficking is repulsive, to say the least, but a growing concern.
Finding out that a lot of our DD individuals are becoming targets right now, and that's what makes them the vulnerability of the actual traffickers that we have. And also Ohio is number 4. They're ranked number 4 as far as human trafficking, and Toledo, Ohio is an actual hub for human trafficking.
Our Community Inclusion Department is opening the door to the community by helping individuals become more independent, often through safe travel training.
I just had a girl a couple weeks ago who I've trained to get from her home to her job, and her mom didn't think she could do it. She wasn't well aware that she could do it, and when I called her up at home and told her, hey, I got the route planned out from your house to downtown to switch buses and then back to your job, she was a little nervous about it, you know, with the anxiety and whatnot. And once we did it, you know, and I got back to her home, she's like, I can't believe how easy that was, and I can do this, and I can't wait to tell my mom how I could do this on my own. And she was just really looking forward to becoming more independent.
We are helping enhance the lives of people with developmental disabilities by sponsoring the FANS Network, friends, allies, and neighbors.
The FANS Network is very excited to work with Salute and the Heart of Lucas County, which are 2 groups run by people who are served by the board advocating for themselves and taking on leadership roles. We will work with those groups to help develop the opportunities in the community, one person at a time.
And as we work to open the community, we also support efforts of self-advocates through organizations such as Salute.
Salute is Self-Advocates Lucas Toledo. It's a culmination, and we are a group of young adults that are focused on self-advocacy, peer leadership, and connecting with business and community leaders. And this is all a result of the board leadership deciding that individuals need to have more of a say in how their services are delivered.
And we could not end our video without a big salute to our wonderful Special Olympics program. With its focus on health through a partnership with the University of Toledo and our Lightning basketball team that played in the state finals, and our unified team with UT that just recently played for a national title. And it goes without saying that the Lucas County Board of Developmental Disabilities will continue to be a sound steward for public dollars. Our mission is to improve life so that individuals with developmental disabilities reach their full potential, adhering to these core values: